My name's Jeanne. I'm 43 and I'm from New Boston, New Hampshire. I had a lot of heavy bleeding, a lot of blood clots. Also, I had a lot of pain. I was taking a lot of Advil. I was going through a large bottle a month. The Sam Club size, not the little one, the huge one. About a month, I saw a doctor and they just said, you're 40. I'm like, well, this has been going on for 10 years. I think it's something more than that. They said, okay, well, we can give you some treatment options. One was birth control pills, which was not for me because I have high blood pressure. They also offered the IUD, which they kind of said that might be my best option. They also offered the ablation. And they said, lastly, surgery could be an option. I ended up going with the IUD first. Did not work for me. I had it in for 5 months and never stopped bleeding. So I went to bed. My boyfriend kept poking me all night because he knew I was going to the bathroom every 15 minutes to change. I was sleeping on a garbage bag because I didn't want to ruin everything. And he would put his hand under my nose to make sure I was breathing. He was afraid I wasn't going to wake up. So I said, should I call somebody? So I ended up calling Ask a Nurse. They did refer me to another gynecologist. And they said, you might want to go to the emergency room. I was told because I had so much bleeding, I was anemic at the time. And they said the Da Vinci would be an excellent resource for me because the bleeding would be minimal. So I took the pamphlet, wrote down the information, went online, and then when I went in for my appointment, I said, I'm ready. I was in so much pain, so much embarrassment every day that I didn't care. I was hooked up to a morphine machine and they kept telling me, go ahead and push the button. I was telling them I didn't really need it because I didn't have any pain. I did have a little pain in my right shoulder from some air that was left in my body from the surgery. But other than that, I had very little pain and they kept telling me, stop downplaying the pain. And I said, but I really don't have any pain. My recovery at home was unbelievable. I have to say, I got home, they give you a Percocet to take the ride home. I didn't take anything. That night I took 2 Advil. That's the only medication I took my whole recovery period. I would say within 13 days, I was back to work full time, 8-10 hours a day. The experience I had did meet my expectations. I was actually pleasantly surprised by the minimal amount of pain that I did have after and how quickly I did recover and go to work. I absolutely would recommend the Da Vinci surgery to anybody, male or female, because my uncle had prostate cancer and he had the Da Vinci. It runs in the family. And my sister had it as well. She had hers July 9th, so a little after mine. She was diagnosed with cancer. So they did the Da Vinci. She's good. I would say don't hesitate to go through the Da Vinci surgery. It's just not worth putting your life off.